California.
There are an estimated 1.2 million uninsured Californians who are eligible for financial help through Covered California or Medi-Cal. So now is the time to sign up for coverage, and Covered California is the place you can go to see if you're eligible for some of that financial help to bring that cost of the coverage within reach. Here to tell us more about affordable plans from Covered California is Executive Director Peter Lee. Good morning, Peter.
Great to be with you, though. I've got to say, I don't want to smile now after that last segment. I'm worried about my whiteness here.
You should smile. You're helping a lot of people get covered with their insurance. And this issue
Absolutely.
about insurance and access to health care, it's taken on new importance during this COVID pandemic. For those who don't know or aren't familiar, tell us what Covered California is and who it's for.
Yeah, so Cover California is a private entity, part of the state of California, but we don't work for the governor or the legislature. We're independent. We actually work for Californians, and our job is to give Californians the best options for healthcare coverage if they don't get insurance through their job. And people can come to Cover California, coveredca.com. We negotiate on their behalf with health plans, 11 health plans. We have consumers back and negotiating with them, but then we're also the one place people can get financial help. So 9 out of 10 of the people that sign up through Cover California actually get financial help, and often a lot of help, to bring down their cost of health insurance. Because look, healthcare in America is too expensive to afford it without getting a leg up. And that's what we're here to do. And you're seeing some of these images are licensed insurance agents, because to get signed up, you can either come to our website, coveredca.com, or go to our website and find a local insurance agent near you. And even though you don't want to visit them in person right now, stay at home. Now's not time to leave the house, but you can call them up. They'll help you over the phone to get enrolled, which you need to do before the end of this month to have coverage starting January 1.
Well, you mentioned financial help, and that's such a big issue because a lot of people maybe have lost their job or have a loss in income. So they can just go to the website, and then it will tell them what financial help they're eligible for through Covered California?
Absolutely. You go to the website, and there's one of the features called Shop and Compare. And literally, in 2 minutes, you put in how old you are, your zip code, your income, your family size. Bam, you're going to get results right then saying your, so it's upper corner, you see Shop and Compare. The upper corner there is the, you'll be told, here's the plans available for you, but you're eligible for $700 a month of financial help. So your cost could be as little as $10.
Wow.
Or more if you want to pick a more expensive plan. But you're in the driver's seat. We're providing you financial help, but then you pick the private plan that's right for you, which carrier, and how rich the benefits are.
Yeah, so
And
there are
again,
different options. That's great. Now,
there's a lot of
how many consumers, Peter, are going to qualify for financial help, and how much would the average consumer receive?
Yeah. Well, so like in the LA area, there's about 400,000 people eligible for either Medi-Cal or Covered California. Huge number. Remember, you come to us, we'll help figure out if you're eligible for Medi-Cal. But if you make more money than Medi-Cal, your subsidy, on average, you're paying $100, and the state and federal government paying $600. So, but for some people, they might be paying $1 a month for really good coverage. Others, it might be a few $100s because they make more money. It's adjusted by your income. But one of the things that happened last year, 2020, first year ever, the state of California added financial help on top of the federal help. So many middle-class Californians are getting help that they were never eligible for before. So people really need to check it out and see if they can afford it. Many will be surprised.
And Peter, in closing, why is it so important for people to really be sure that they have health insurance, that they're covered through Covered California?
Well, let me just, this year is different than the other. Like, this is a mask. We sent out 3 million of these masks, and they say, get covered, stay covered. There's two parts of that. We should all be wearing our masks when we leave the house, if we have to leave the house. But we should also be covered with health insurance. We've learned with the COVID pandemic, never has it been more clear that we all need to have insurance. But it's not just about COVID. It's about cancer, it's about heart disease, about diabetes. You want to have health coverage to have preventive services to not get sick. But if you get sick, you don't want to end up in a hospital and walk out only $50,000. Insurance gives you peace of mind and makes sure you stay healthy. Everyone should sign up, coveredca.com.
And Peter, last question. You guys extended the deadline. So when is that last date to get covered from Covered California?
Yeah, well, there's two important dates. Open enrollment, which is what we're in right now, goes actually through the end of January. But you don't want to wait till January because you don't want to go a day without insurance. We extended our deadline to have coverage start on January 1, starting the new year with health insurance. You need to sign up by December 30th. But
December
don't wait till
30th.
the last minute.
Yep, don't
Don't
wait.
wait. Do it now. Don't do it before. Give yourself a Christmas gift of coverage.
Thanks so
And
much,
so
Peter.
get
We've
on
got to
board
get
and do it
going.
now.
You've got to determine your eligibility, and you can find that health plan at coveredca.com.